Okay, let's talk about what high blood pressure is and how it's determined. High blood pressure, or hypertension, is a condition where the force of blood pushing against the walls of your arteries is consistently too high. Blood pressure is measured with two numbers: systolic pressure, which is the top number, and diastolic pressure, which is the bottom number. Systolic pressure measures the pressure in your arteries when your heart beats, while diastolic pressure measures the pressure when your heart rests between beats. These measurements are typically given in millimeters of mercury, or mmHg. To determine if you have high blood pressure, a healthcare professional will typically use a device called a sphygmomanometer, which is the typical arm cuff used to measure your blood pressure. Nowadays, you can also use digital home blood pressure monitors. Several readings are usually taken to establish a baseline, as blood pressure can fluctuate throughout the day. A single high reading does not necessarily mean you have hypertension. According to current guidelines, a blood pressure reading of 130/80ths of a millimeter of mercury or higher is generally considered hypertension, although these numbers may vary slightly depending on the source and individual circumstances. If your blood pressure consistently measures higher than this, it is important to consult a doctor. Okay, let's discuss the modifiable risk factors for hypertension and how they contribute. These are factors that you can change through lifestyle adjustments. One major modifiable factor is diet. Consuming a diet high in sodium causes your body to retain more water, which increases the volume of blood, therefore raising blood pressure. On the other hand, a diet low in potassium can also contribute, since potassium helps regulate sodium levels and blood pressure. Another significant modifiable risk factor is physical inactivity. A sedentary lifestyle can lead to weight gain and reduced cardiovascular fitness, making your heart work harder and increasing your risk of hypertension. Being overweight or obese, which often results from inactivity and poor diet, also contributes as it increases the workload on the heart and affects the way hormones regulate blood pressure. Lastly, excessive alcohol consumption can elevate blood pressure, and smoking damages blood vessels, making them less flexible and contributing to hypertension. Stress is also a factor, since during stressful periods, the body produces hormones that can cause a temporary increase in blood pressure. However, chronic stress can contribute to long-term hypertension. Okay, the non-modifiable risk factors for hypertension are those that you cannot change. These primarily include age. As we get older, our arteries naturally become stiffer and less elastic, which can lead to increased blood pressure. This is a natural process that can't be altered. Family history. Having a family history of hypertension means you're more likely to have inherited genes that make you susceptible to high blood pressure. Unfortunately, you cannot change your genetic makeup. Race. As mentioned before, certain racial groups, such as African Americans, are more likely to develop hypertension. This is believed to be due to a combination of genetic and environmental factors that are difficult to modify. These non-modifiable risk factors mean that some people are naturally more prone to developing high blood pressure than others. While you can't change these factors, you can still focus on managing the modifiable ones through lifestyle changes to significantly reduce your risk. Sure, let's go through them one by one. First, maintaining a healthy weight is important because being overweight or obese increases the risk of high blood pressure. Next, a balanced diet low in sodium and saturated fats helps to regulate blood pressure. Then, regular physical activity strengthens the cardiovascular system. Limiting alcohol consumption is also key, as excessive drinking can raise blood pressure. Avoiding tobacco use, which damages blood vessels, is essential too. Finally, stress management can help, since chronic stress can contribute to hypertension.